Welcome to Integrative Medicine Perspective. I'm Dr. Wenli Liu. Recently, there has been a very popular weight loss medication called Ozempic. Ozempic is primarily used as a sugar-lowering medication for type 2 diabetes because it has a great appetite suppressing effect. It is also used for weight loss. A friend of mine asked me, Ozempic is so popular right now, and your clinic deals with so much weight loss and diabetes management. Why haven't I seen you expressing much enthusiasm about the medication? And I think that's a great question. So let's talk about Ozempic and the pros and cons of this type of medication. Let's first learn a little bit more about Ozempic. The molecular structure of Ozempic is very similar to a natural hormone in the human body called glucagon-like peptide 1, short for GLP-1. So what is GLP-1? It is named so because its structure closely resembles glucagon, but their functions are opposite. Glucagon is produced by the pancreas and raises blood sugar levels. GLP-1, on the other hand, is secreted by the intestine with a function to lower blood sugar. GLP-1 stimulates the pancreas to produce insulin, which lowers blood sugar. Additionally, GLP-1 also has two other functions. It suppresses appetite signal in the brain and slows down gastrointestinal motility. So the end result is a reduction in food intake. So now you might wonder why obesity exists if our bodies can naturally produce such appetite suppressing hormone. That is because GLP-1 is secreted by L cells in the intestine, and the secretion only occurs when L cells come into direct contact with energy nutrients, especially sugar. Now, interestingly, L cells are mainly located in the lower part of the small intestine and large intestine. Under normal circumstances, the absorption of energy nutrients, including sugar and protein and fat, is completed before they reach the end of the small intestine. But if we overeat, to make them reach the end of the small intestine or even the large intestine, L cells will send us a signal. That is GLP-1, saying that's enough, don't eat more. So under normal circumstances, GLP-1 is only produced when we're in a fat state, especially when there is an excess of energy intake. L cells do not have direct contact with energy substances when we're fasting. So we don't have a high level of GLP-1 when we don't eat. On top of that, GLP-1 has a very short lifetime in the body, lasting only 1 to 2 minutes before it's rapidly broken down by enzymes. So its control over our food and energy intake is quite limited. Ozempic, on the other hand, greatly exaggerates the physiological effects of GLP-1. It not only has all the functions of GLP-1, it also has a very long duration of action time in the body, requiring only once weekly injection to achieve sugar lowering and weight reduction. It sends us a persistent signal of you've eaten too much, regardless of whether we've actually eaten. By continuously suppressing appetite and slowing down gastrointestinal motility, it produces a great result of weight loss. So isn't Ozempic and similar medications perfect for obesity? Or could it possibly have any downsides? Let's talk about the pros and cons of Ozempic. We'll begin with the good part of it. When we try to lose weight by simply reduce food intake, we will experience hunger, which is a great obstacle, sometimes overwhelming obstacle to successful weight loss. Ozempic eliminates that obstacle. So it makes the weight loss effort much easier, and that's the good part of it. What are the not so desirable aspects of Ozempic? Well, side effects can be one concern, but I won't focus on them today because they can be easily found on the FDA websites. Let's talk about some other reasons why Ozempic and similar medications may not be the best choice for weight loss. The use of Ozempic can be much more complicated than it appears to be. First, Ozempic slows down gastrointestinal motility. This can prolong the amount of time medication stay in the stomach and intestine. So this can affect their absorption speed. If someone taking Ozempic also has other medical conditions and is taking other medications, the onset of their medication's effect may be delayed, or even the absorption of their medication can be reduced, leading to decreased effectiveness. So this is one aspect we needed to consider when making a decision to use Ozempic. Second, again, because Ozempic slows down gastrointestinal motility, this can also prolong the amount of time food stays in the digestive tract. And this can affect bacterial environment of the entire digestive tract, from the stomach to the small intestine, all the way to the large intestine. The longer food stays in the digestive tract, the greater the potential impact it has on bacterial environment, which can in turn affect nutrient absorption and other physiological functions related to the microbiome. So this is the second aspect we need to pay attention to when using Ozempic. Third, Ozempic's weight loss, including a significant reduction in muscle mass, is not ideal. Muscle mass is the primary site for sugar metabolism. A reduction in muscle mass can decrease our ability to process sugar. So Ozempic's weight loss does not address the underlying mechanism, the underlying pathology of obesity, specifically insulin resistance. It may even worsen the state of insulin resistance by further reducing muscle mass. So Ozempic's weight loss mostly addresses surface level issues without correcting the underlying pathology. Additionally, it may create even more problems. Fourth, Ozempic's weight loss is passive. Food intake is passively reduced. So when Ozempic is discontinued, appetite is no longer suppressed. The obstacle to weight loss returns. When appetite is not managed properly, it is easy to increase food intake, leading to weight rebound. Managing appetite actively instead of passively during the process of weight loss, it's something we need to do. The skill of actively managing appetite needs to be trained and sharpened repeatedly for us to be very comfortable with it. There are two main aspects of actively managing appetite. One is that it comes with almost no side effect. Secondly, the success reached by active methods can be long-lasting. That does not mean it does not have setbacks. I have used the active methods many times, each time with great success. The point I'm trying to make is that active methods can be used repeatedly with few, if any, limitations. Medications, however, may not allow for repeated use. Therefore, I have reservations about relying on passive methods to address various issues in weight loss, especially methods that don't address the root causes. Fifth, poor appetite can often lead to negative emotions. Whether Ozempic can cause depression or anxiety is not something we have very much focused on in clinical trials, but I think it is an important question worth further research and observation. That's all for today's discussion. Please leave comments and questions. Thank you for watching. I will see you soon.